Okay, so antipsychotic medications have evolved to treat schizophrenia, but before these arose, they used to use things like lobotomy, psychosurgery. So lobotomy is a surgical separation of portions of the frontal lobe from the rest of the brain, and they used it as a treatment for schizophrenia. And when they used this, there was little scientific evidence to think that the surgery would be effective. And then they used psychosurgery, which was surgical modification of the brain to treat psychiatric disorders, and it involves much smaller lesions, and it is rarely performed, and it's only used as a very last resort, and it's still used today in some cases, and it's helpful for people who have severe epilepsy because they can remove damaged brain tissue, and it's also being explored for other disorders. So a drug that has evolved is chlorpromazine, which quickly replaced lobotomy as a treatment for schizophrenia. It originally developed as an anesthetic, but then it was changed to reduce the positive symptoms of schizophrenia that include auditory hallucinations, delusions, and disordered thinking. Antipsychotic drugs came a little later, were eventually found to share a specific action where they block postsynaptic dopamine receptors, particularly dopamine D2 receptors, which helped evolve the dopamine hypothesis, which is that people with schizophrenia suffer from an excess of either dopamine release or dopamine receptors. So amphetamine psychosis is a delusional and psychotic state closely resembling acute schizophrenia that is brought on by repeated use of high doses of amphetamines. Typical antipsychotics are a major class of antischizophrenic drugs that share an antagonistic activity of dopamine D2 receptors, like the antipsychotic drugs. So dyskinesia is difficulty or distortion in voluntary movement. And there's tardive dyskinesia, which is mostly affects the face, mouth, lips, and tongue. And it can be used from prolonged use of antipsychotic drugs. And then there's supersensitivity psychosis, which is an exaggerated psychosis that may emerge when doses of antipsychotic medications are reduced from upregulation of receptors that occur during drug treatment. Atypical antipsychotics are a class of antipsychotic drugs that have actions other than D2 receptors antagonism, and they characterize the typical antipsychotic. An example of this is clozapine. So PCP is also called angel dust, and it's a drug that makes many people feel dissociated from themselves and their environment. Psychotomimetic is a drug that induces a state resembling schizophrenia, and ketamine is a dissociative anesthetic similar to PCP that is an antagonist for MNDA receptors. So the glutamate hypothesis is that schizophrenia may be caused in part by understimulation of the glutamate receptors. Bipolar disorder is another mental disorder that is also causes manic depressive illness. Is a psychiatric disorder characterized by periods of depression that alternate with excessive, expansive moods. So people with this are really happy and then really sad. And most people suffering from bipolar disorder benefit from treatment with lithium. And that is an element that, when administered as a drug, often relieves the symptoms of bipolar disorder. So another psychiatric disorder is depression that is characterized by symptoms as an unhappy mood, loss of energy, interest and appetite, and difficulty concentrating.